So the question, of course, is how big a threat is the bird flu to those of us who don't spend a lot of time, with wild birds? Well, for more on what all of this means, we are joined right now by Dr. Amesh Adalja, an infectious disease expert, senior scholar at the Johns Hopkins Center for Health Security. Thank you so much for coming on. So these mutations that the CDC found in that first severe case in a human, that could make it easier for humans to get infected. Should we be worried, and how worried should we be?
I don't think the general public needs to worry. You have to actually understand that those mutations weren't something that he contracted. Those mutations developed in that patient. So they aren't something that is spreading amongst avian species. This is something that he evolved. Obviously, we worry about him transmitting it to other individuals, and we track these mutations, but I don't think that this changes anything major in terms of the public health risk. And these are the same mutations that we saw in that teenager in Vancouver who also had a severe case. So there's something about these mutations that may be associated with severe disease, but I don't think it changes the general calculation or public health assessment to the average American.
What does it mean that the virus mutated, especially after the man got infected? Is that not alarming?
All viruses mutate. That's what happened with COVID. That's what happens with HIV. That happens with influenza. What's happening is that this virus infects a human, and it seems that this person got it from wild birds. And while it's in that person, it is evolving to try to adapt to humans. But it was a dead-end infection, meaning he didn't transmit it to anyone else. So that's very different than if there was a circulating virus that had these mutations that was infecting people on its own. That's where we kind of worry about adaptation to humans and the ability for the virus to spread efficiently. There's been no signs of the virus being able to spread efficiently from person to person, and that's why we track these mutations to make sure that that's not happening.
Well, I guess the question is, 65 human cases of bird flu nationwide, is that not a lot?
It is a lot, and the vast majority of them have direct contact with either infected poultry or infected wild birds or dairy cattle milk that's infected. So that is actually reassuring. If we saw people that were getting infected with no link to that, and there have been a couple of cases, one in California and one in Missouri, where we don't quite understand how the person got infected, that's where we start to raise the alarm, is when we see this spreading without much epidemiological link to the known animals that have it. And that's what we keep looking for. That's why there's so much aggressive testing going on. The USDA is increasing their ability to test for this in raw milk. That's why we have our flu centers on alert to try and type all of our flu viruses to make sure that it's not H5N1. So we're starting to do what we need to do. We should have been doing it months earlier, but it's starting to happen now, and we have to take this seriously. But right now, the public health assessment hasn't changed.
Talking about change, the CDC agrees with you. They maintain that the risk to the general public hasn't changed. It remains low. How quickly could this escalate from being maybe not a big deal to becoming a very big deal? I mean, I hate to say it, everything changed after COVID. It's a have to ask the question, is there a potential that this could spiral out of control?
There is always that potential that it could happen, that this virus could recombine with another flu virus and come out with something more efficient. That's why we were so worried about that pig case that happened in Oregon, because pigs can be infected with multiple different strains. We also worry about humans getting infected with the seasonal flu, regular ordinary flu, and this bird flu, and them swapping genes. So it could change very quickly, but this is a virus that's been around since 1997, been infecting humans since 1997, and hasn't been able to do that. So that gives you some peace of mind that the constraints that this virus faces to become an efficient human transmitter are pretty high, but it's not a non-zero risk, and that's why we're taking this very seriously and tracking these mutations.
Because of that history, does that mean that there are treatments or vaccines for bird flu, especially with the mutations going on?
The treatments are the same as for seasonal flu. So drugs like Tamiflu, Xofluza, those antivirals will work against bird flu strains. And we do have stockpiled vaccines and strategic national stockpile that are closely matched to the circulating strain. And there are efforts to develop new vaccines. There's been contracts that have been issued. So we will have vaccines. There's a question about when we start to vaccinate poultry workers, cattle workers. That's something that's needs to be part of the public discussion, but there's no need for the general public to think about a vaccine, but we are preparing for that eventuality if it occurs.
And then people watching this, how do they keep themselves safe? How do they keep their pets safe from the bird flu?
Number one, don't drink unpasteurized milk for a whole host of reasons, not just bird flu. Number two, if you're around sick or dead birds, don't handle them. If you work on a dairy farm or you're going to a petting zoo, be very careful around certain animals that have been known to be infected with bird flu. Keep your pets indoors, especially cats that may be going into barns, that might be eating mice, that might have access to raw milk. Don't feed your pets raw milk either, or unpasteurized milk. that's basically what you can tell the general public to do. I think the key thing here is getting control of this on dairy farms, in poultry, and then basically continuing to track these human cases to see if there's any worrisome changes occurring.
Real quick, doctor, is there warning signs if your pet is, exhibiting symptoms of bird flu that you should be aware of?
Well, if your pet looks sick, if it's not behaving the same, if it's respiratory symptoms looking like it's having difficulty breathing, but I'm not a veterinarian, but generally when your pet is sick,
Yeah.
you should be thinking about a whole host of things, including avian influenza if they've exposure.
I don't know. You helped us a lot right here. You gave us some incredible information. I would turn to you for anything right now. So I thought you'd be the guy to talk to about if your pets look sick or not. But listen, thank you so much for coming on. Really appreciate it. This is incredibly helpful. Dr. Amesh Adalja, thank you so much and happy holidays.
You too. Thanks.